So the first presidential debate of 2024 has just concluded. It was on June 27, and it was an interesting debate, if you can even call it that. But basically, in today's video, we'll be going through some healthcare takeaways that I sort of spotted during the debate, which was very, very difficult to follow, really. Again, really, I'm not going to give any opinions or anything here, but I felt as if healthcare was really sidelined in this debate because healthcare really is, especially the price of prescription drugs, healthcare in itself. We have so many hospitals and clinic systems closing around the US. I feel that both candidates really did not give the healthcare sector the importance that it really needed. And again, like, it is a huge, huge component of what Americans want to hear. So, without further ado, I'll basically be reading this article from Becker's Hospital Review, and I'll just go ahead and give a little bit of insight just from my position as a medical legal consulting physician. And again, I work with many hospitals and clinic systems trying to improve their systems. And again, like, if you watch my previous videos on the state of the US healthcare system, I think it's plain to see that it's actually collapsing in real time. So I was actually quite disappointed that, neither Biden nor Trump really talked about it. Like, they were sort of bickering between themselves, which I think we all are aware of. Anyway, so here's the article. Again, it's from Becker's Hospital Review. So I'll just read it verbatim and then sort of talk about it. President Joe Biden and former President Donald Trump spent a small portion of their 90-minute presidential debate on June 27 highlighting issues affecting healthcare leaders, from prescription drug costs to the opioid crisis. The candidates spent relatively little time discussing healthcare issues or policies to reduce costs, which voters have indicated is a key election issue. So then there's four basically takeaway points from the debate, which aired on CNN, of course. So point number one, prescription drug costs. So this is something that I also mentioned a lot in my two previous videos, the videos of which I'll link below as well. So prescription drug costs. The cost of prescription drugs, which nearly 40% of Americans struggle to afford, came up briefly in the first question of the evening when the candidates were asked about the state of the economy and inflation. The two sparred briefly over who is responsible for lowering the cost of insulin. After Mr. Biden touted capping insulin costs at $35 per month as a win for his administration, Mr. Trump argued he was the one that brought down insulin costs for seniors. CBS News broke down the claims in a fact check. In 2020, during Mr. Trump's presidency, Medicare created a voluntary program in which some health plans and insulin manufacturers agreed to cap out-of-pocket costs at $35 per month. By the end of 2021, about half of Medicare Advantage or standalone prescription medication plans were participating. When Mr. Biden signed the Inflation Reduction Act into law, insulin costs were capped at $35 per month for Medicare beneficiaries, ending the voluntary program. In February, drug makers were selected to begin price negotiations with CMS for 10 of the most expensive drugs in the US. Under the Inflation Reduction Act, Medicare Parts B and D have negotiation powers that will apply to the price of a limited number of drugs with no generic or biosimilar competition. Lower prices for the first 10 drugs are slated to take effect in 2026. Medicare is limited to negotiating prices for 20 drugs per year, though Mr. Biden has said he will work with Congress in a bid to boost those negotiation powers to 50 drugs if he is re-elected. During the debate, Mr. Trump did not comment directly on the Inflation Reduction Act. He has previously criticized the legislation and said his administration would look to dismantle many of the law's provisions if he returns to the White House. While speaking at Milken Institute's Future of Health Summit last fall, Alex Azar, who served as HHS Secretary under the Trump administration, criticized Medicare's drug pricing negotiation powers, citing concerns about stifled innovation and delays in bringing new drugs to the market. Okay. Again, none of this is financial, legal, medical advice. It's just really just my little 2 cents here and there. Neither of them are addressing the primary issue here. And again, all of us physicians and really it's not even most physicians, actually. It's people who work in more like healthcare administration and who sort of have a perspective on what are the underlying pins of the pharmaceutical system in general, right? So a lot of physicians, like we're you know, like the people who, doctors who work in the clinical world, they're actually not informed as to how, when you sign a prescription, how, where does that where does that medication come from? How does it go to your patient? How much does your patient even pay, right? So a lot of times, you know, insurance will come back to the clinical doctor and say, hey, like, you know, this medication is not part of their insurance, like this the patient's insurance will not cover this, so you have to give an alternative. But a lot of times the alternative medication is not that great for that specific person, and it's all based on genetics and DNA and demographic. And this is a real thing. Every human is very unique, right? So as physicians, we intimately know this. Like, you know, Susie from Louisiana is different from Raj from India, right? So we're both Homo sapiens, but it's extremely different. So the medications and the medications are just chemicals, right? So the chemical compounds that work for one human are different from the ones that work in a different human. So nothing weird with that, right? Like, it makes sense. So, but the problem with insurance and you know, insurance companies is that they're not doctors, right? Like, they're not scientific anything. So they're just people who are like, okay, we have to keep our costs low. We can't subsidize, like, you know, they're subsidized. Like, a lot of medications are subsidized through the government. But what they're basically talking about here is that, you know, Medicare is not doing a good enough job. That's one side of the argument. But the other side of the argument, which isn't even being talked about here, like, they're just bickering, really. So what's happening across the US is that private equity groups are buying off everything. So they're buying hospitals, they're buying clinics. Watch my Ozempic video, which talks about sort of like how Ozempic and Wegovy became these like popular celebrity-fueled drugs that are leading to a ton of adverse side effects. But it's a very common side effect of this failure of the US healthcare system to really be regulated appropriately. I don't have an opinion on this. I'm not a politician. I see the American empire as going in a certain direction right now as of 2024, but basically neither candidate is talking about this. Like, you know, they're not talking about how private companies are swallowing up, you know, even drugs. Like, you know, drugs are, like, healthcare should be a human right, right? So when drugs are created, there needs to be some sort of regulatory body that actually cares about the common man, like actually cares about the common person. Not everything can be just whatever the price you want it to be. So that's why they're talking about insulin, because a lot of you remember, a lot of you are, you know, like my age, 30 and above. There was actually a single person that owned the rights to a very common form of insulin. Insulin is a life-saving medication. It's not some luxury product. It's literally, it should be like water. It should just be a free thing. Because some humans need insulin to survive, like not, you know, not to have a better life, like literally to survive. Like, they will die if they don't have insulin. And this one individual had the rights to it. And so he and his company were basically skyrocketing the price of it. And it led to a lot of people just not having this life-saving medication. So that's why, you know, if we live in a society, like, there has to be some rules, or, you know, but again, you know, what I'm not siding towards one side or the other, but neither individual really addressed this issue. They didn't come up with any solutions. They were just sort of saying, oh, what you're doing sucks. Oh yeah, well, you didn't do anything back when you were president. And it was just very unfortunate. Okay, topic number 2, abortion. Pretty big deal. I'm going to keep my lips tight on this one. All right, so the candidates spent around 10 minutes on the topic of abortion, with Mr. Trump reinforcing his view that the legality of abortion belongs in the hands of states to decide, and Mr. Biden vowing to restore the federal right to abortion if reelected. In June 2022, the Supreme Court overturned Roe v. Wade. Since then, 14 states have enacted a total abortion ban, and 7 states have gestational limits of 18 weeks or less in place. According to a tracker by the Guttmacher Institute, Mr. Trump said he supports exceptions for the R word that rhymes with grape incest, and the life of the mother. And Mr. Biden said he believes decisions about care should be left to physicians. Again, because I got a comment about this the other day. The reason why we can't, as content creators, especially on YouTube, if we say certain words, then YouTube flags us. So that's why in my video, even though it's funny, right? Like it's a medical channel, like we can't say certain words. So like, for example, that's why people say unalive instead of the D word that rhymes with bread. It's sorry, instead like the K word that rhymes with Bill. Like we can't say that word on YouTube, which is kind of funny. But it's something that I had to, I actually, yeah, so I had to like retape one of my videos because of that. Anyway, so the Biden administration issued guidance to hospitals following the overturn of Roe v. Wade to clarify that abortion is covered under the Emergency Medical Treatment and Labor Act. The decades-old federal law, which requires hospitals to provide all patients appropriate emergency care, including a medical screening examination and stabilizing treatment, if necessary, has been at the center of legal disputes over whether it preempts state law, where abortion is prohibited, and does not make exceptions for the health or life of a pregnant person. Most abortion bans include some kind of exceptions for emergencies, though language in many cases is vague, leaving physicians uncertain of the circumstances in which they should perform the procedures. Lawyers and hospital administrators have said the Biden administration's focus on EMTALA has done little to clarify guidance for healthcare providers who feel stuck between the repercussions they face if they violate their state laws and complying with federal law. Hours before the debate on June 27, the Supreme Court ruled in favor of permitting emergency abortions in Idaho for now. The justices did not settle the larger question of whether EMTALA covers abortions when deemed necessary by physicians to protect the health of a pregnant woman, only that abortions in emergency cases may resume temporarily in Idaho. The case now returns to the U.S. Court of Appeals for the Ninth Circuit. And then the article continues, this is not a victory, it's a delay, says an OB-GYN physician who works at a hospital in the United States and often treats women with high-risk pregnancy complications. Okay, with all this back and forth, we aren't just able to practice medicine, we have to analyze what the court is saying, which leaves us with more uncertainty. Earlier this month, the Supreme Court ruled in favor of the FDA when it upheld the approval of mifepristone, a drug used in about 2/3 of all abortions. When asked whether he would block abortion medication, Mr. Trump said he agrees with the court's recent decision and that he, quote, will not block it. Okay, so this was a very weird, like, political dance between the two of them, because what they're basically saying is that, yeah, they support. It's kind of like that Simpsons episode where, remember when Kang and Kodos, like those two aliens, like masqueraded as Bill Clinton and Gerald Ford, and then they were saying like one guy was saying abortions for all, and then half of the crowd booed, and then he was like, okay, abortions for none, and then the other half booed, and then he was like, okay, abortions for some, miniature American flags for everyone, and then everyone started laughing or like applauding. So that's literally how these abortion debates sound like to a physician, because it's like, look, like what you guys are both basically, like you're both on the same page actually. This is very confusing to a layperson, because what they're basically saying is that, yeah, sure, like abortion, like, we're just playing this political game where it's like, I'm saying it's bad, you're saying it's good. No one is actually saying it's bad or good. Okay? So like they're both basically saying that, like, look, like, the problem with the whole Roe v. Wade thing is that, one entity or one group thinks that it shouldn't be a federal thing. Like healthcare should not be, like some healthcare procedures should not be a federal ruling, it should be a state ruling. And that's really what the United States of America is based on, right? Like it used to be, it's a republic. So basically each state has its own rules. Like, for example, I'm from California. California has drastically different rules than, let's say, Texas or Florida or Alabama, right? That's a pretty normal thing. Like that's the whole reason why the United States of America exists. It's to give individual states its own rights to rule how it wants to rule. But of course, there's like federal and umbrella regulation on top of that to ensure that Americans are pretty standardized. Again, I'm not a politician. I'm not opining on any of this. But basically, they're both saying the same thing. Like they're both saying that yes, for emergency situations, abortions are fine. And so some states have to abide by these emergency, situations. But in total, like, abortion should not be allowed after a certain point. Medically also, like this is confirmed by the family board, the OB/GYN board, the pediatrics board, because it gives harm to both. It gives harm to the mother the further along the abortion is. But at the end of the day, humans are going to human, right? Like a pregnant woman who is, hell bent on doing something, they're going to end up doing it in some way or another, right? Anyway, we'll see where that goes. I don't know. It's a lifelong debate, right? So, yeah. All right. Point number 3, Medicare. I really wanted this video to be short, but it's already 16 minutes, so sorry about that. All right, so Medicare came up roughly 12 minutes into the debate, including its future under their policy aims. Mr. Trump made the statement that Mr. Biden's administration is, quote, destroying Medicare because undocumented immigrants are coming in, they're putting them on Medicare, they're putting them on Social Security, they're going to destroy Social Security. The Washington Post addressed the claims in a fact check, noting the payroll taxes paid by undocumented immigrants. The Post roughly calculated Social Security payments made by undocumented immigrants at about $27 billion per year recently. For Medicare, it should be at least $6 billion, as the Medicare tax is about 23% of the Social Security tax, the fact check said. Mr. Biden also accused Mr. Trump of trying to enact cuts to Medicare. He wants to get rid of Social Security. He thinks that there's plenty to cut in Social Security. He's wanting to cut Social Security and Medicare, Mr. Biden said, according to CNN. The New York Times fact-checked this claim, noting that Mr. Trump, while previously suggesting he may be open to cuts, has repeatedly pledged to protect Social Security and Medicare. Medicare's Hospital Insurance Trust Fund is projected to reach insolvency by 2036. That's not good. And again, watch my videos on the U.S. It's called the U.S. healthcare system has collapsed, and we're literally in the middle of the decline right now. And again, it's every single component of healthcare in America is being negatively affected. I'm not exaggerating. And because I'm not a clinical doctor anymore, I can say this stuff. Like I can actually share this information because I see it. Like I'm in a position where I can actually see, I work with hundreds of hospitals, hundreds of patients around the US. It's happening. That's just the reality. I have no opinion on it. It's happening. Yeah. So, and again, for those who aren't aware, Medicare is basically just insurance for the elderly. That's really what it is. Like, because again, like if you go to a hospital and you get, like, for example, like, my wife and I, like when we go to the hospital, it's like a typical bill is like around $1,100, like literally just to see someone. It's insanity, but like, because we have health insurance, like, we still have to pay, which is funny, but like, we still have to pay around like, whatever, like maybe like $200 to like $500. It sucks, right? Like for everyone, it sucks. Like, but, and like, you can't predict when you're going to get sick or when you need, screening services, etc. I don't have an opinion on this. I don't, yeah, it's going it's concerning, I'll say. All right, the final point number 4, the opioid crisis. I'm glad that they touched upon this. Again, like, the problem with this debate is that they did not give it the time that it warranted, because healthcare is one of the top 5 concerns of the typical American, including me, actually. So, I was very disappointed in this debate, if you can even call it that. Like, I really wish that they talked more about just the healthcare sector in general. Like, what are we going to do? Like, we have a rising aging population. We have a very low birth rate right now. So the middle class is just kind of stagnating, or it's going downhill. Like, people in my generation were not able to buy houses. A lot of us are just not getting married or having children. These have societal impacts, like especially on the older generation, because they're all ending up in nursing homes, which is very sad actually, because nursing homes get litigated all the time because of just lack of staff, lack of proper care. And you know, in my personal, like even religious beliefs, it's like we should not be sending off our parents to some nursing home. Like we should be taking care of our parents because they took care of us. Anyway, so point number 4, the opioid crisis. Toward the end of the debate, the candidates were asked about the opioid overdose epidemic. According to provisional data from the CDC, there were more than 93,000 overdose deaths in 2020. I personally have gotten many medical legal cases on this. It's very, very unfortunate. An increase of more than 30% from the year prior. Overdose deaths remain near record highs in 2023, despite a slight 3% year-over-year decline, the first decrease in 5 years, according to preliminary CDC data. Within the opioid class, fentanyl's potency and increasing presence in the illicit drug market have made it a significant factor in the overdose epidemic. The highly potent synthetic opioid has been a primary driver in the rise of drug-related deaths in recent years. All right, Mr. Trump and Mr. Biden were prompted to answer the question, what will you do to help Americans right now in the throes of addiction who are struggling to get the treatment they need? In his response, Mr. Trump said the country had been making progress in combating drug addiction and pointed to the COVID-19 pandemic as disrupting progress. He also referenced equipment and drug detecting dogs at the border, basically to control, you know, what they believe is influx of fentanyl. Mr. Biden said the U.S. needs more machinery at the border that can detect fentanyl and more agents. He added that the U.S. is coming down very hard in every country in Asia in terms of precursor for fentanyl. Neither candidate offered a direct answer on how they will improve access to treatment for those struggling with addiction. And again, that seems to be a general trend of this debate. Like, this was a very difficult debate for me as a physician to listen to, because I just kept waiting, but then again, what do you expect, right? But it's like, you know, I just kept waiting to hear some direct, actionable, logical answer, like a solution. I hope this enlightened all of you. Like, you know, just again, this is just my little, this article really hit all 4 points that I noticed. And again, like, I just wish that they talked a little bit more and gave more emphasis on the healthcare sector, but hopefully in a future debate they will. But yeah, and I'll be sure to cover that as well. But thank you for watching. Like, please like and subscribe, share a comment. How do you feel about the debate? What are some healthcare issues that you wish for the candidates to talk about? And yeah, thank you again, everyone, for watching. And we read all the comments. We really, really appreciate you guys. And yeah, hope this video helps. All right, take care.